Good afternoon, everybody. My name is Gavin Morgan, and I'm a Professional Officer for the British Association of Social Workers. Thank you very much for joining this webinar. This webinar, as you all know, is on co-production, and this is to celebrate, well, it's part of the celebrations for National Co-Production Week, which runs all of this week. So I have with me three people, as you can see, if you're looking at the live version. That's Charlotte Goulding from NICE, and I also have Graham Price and Mark Lyons, who are service users and carers who work with BASWA. It's really good to have everybody here today. This webinar, we hope, will have a number of learning outcomes, which should include explaining what co-production is and how co-production can help you in practice, whether you're a frontline practitioner or whether you're somebody who works more strategically. We want this session to be interactive, and if you have a look at your software and your panel, you should see an option to ask questions. We'd like you to put questions to the panel. Rather than ask along the way, we're going to save the questions to the end of the session. The session lasts an hour, so please put your questions to us, and I'll put them to the panel at the end of the session. And if where possible, I'm going to try and bring you in verbally, but if you're not comfortable with that, that's absolutely fine. I'll read them out to the panel as well, but if we can have that discussion, that'll be great. So what I'd like to do, and before I forget, please also note that BASWA England's recently developed a capability statement and CPD pathway for social work with adults who have learning disabilities. This was co-produced with adults with lived experience and their carers, family and friends, and you can find a copy of this in our files attached to this webinar, but we can also have that emailed to you at the end of the session if you email us at england@baswa.co.uk. So I'm going to start with Charlotte, who's in the middle, if for those of you who can see the live version. Charlotte, if you'd like to start.
Yeah,
I'm going to put up your PowerPoint presentation so everybody can see that as well. Just bear with me a moment. There we go.
So welcome everyone to this session about co-production for social workers. Do you mind doing the next slide?
Yeah.
So in this session, I'm going to talk about what co-production means, and then I'm going to go through three different aspects of co-production. So the first part will be about really supporting people with care and support needs in all decisions that affect them, and that's really at the heart of all social work. And then thinking about two other aspects of co-production. So thinking about involving experts by experience in their recruitment and training, and also in producing information, policies and procedures. And within this discussion, I'm going to talk about different aspects of my experience as a social worker, but also in my current role at NICE and different guidance in social care and what that means. And then the last part of this session, I'm going to talk about co-production with people who have learning disabilities. Do the next slide, please. So I'm just going to start with some definitions of what co-production means. The first definition on the left is from the Care Act statutory guidance. So co-production is when an individual influences the support and services received, or when groups of people get together to influence the way that services are designed, commissioned and delivered. So I like that quote for showing that it's about an individual and their own support needs, but also very much about groups of people getting together and influencing commissioning and thinking about different services. And the second quote is from Think Local, Act Personal. It's from one of their guides called Co-Production Commissioning, which is a really helpful resource. And all the references that I've talked about today are at the end of the slides if you want to read them in more detail. So in this quote, it says that this is adapted from TLAC, when a person who uses services is involved as an equal partner in designing the support and services they receive. Co-production recognises that people who use social care services and their families have knowledge and experience that can be used to help make services better, not only for themselves, but for other people who need social care. And I really like from this quote, this interpretation, the importance of people being equal partners and having knowledge and experience that can really inform services. I think that's really aligned to strengthen asset-based approaches to social work And we were just talking together as a panel before we began about the importance of people being considered as equal partners. Can you do the next slide, please? So this is a screenshot from the NICE guideline, People's Experience in Adult Social Care Services. And I wanted to include this because I've used quite a few of the recommendations from this guideline to structure this session. So this is here really for your own reference if you want to go back and have a look in more detail later on. Can you do the next one, please? So the first part of co-production that I want to talk about is about the importance of actively involving the person in all decisions that affect them. So this is from the NICE guideline that I mentioned. And I think this is absolutely at the core of all social work. It very much aligns to the BASWR professional capability framework, the values and ethics of making sure that we work with people in partnership. And the images that are on this screen are from the quick guide that was produced by NICE about working with people in terms of their assessment and care planning. So this is from the guideline that I mentioned before. And the images really emphasize the importance of how to involve people in making decisions. And when I think about my social work experience, these have all been really important points. So involving an advocate and thinking about using an independent interpreter has often been really important. Thinking about different communication aids. When I think about my role in learning disabilities as a social worker, I had to really think about using different symbols and images and written information and trying to explain things clearly. And I think in all of my social work roles, making sure that there's been extra time for people to understand information and making sure that conditions were right when people were looking at information. So in hospital social work, making sure that there is a private room, people had real time to think about the information that I was sharing were all really critical factors. Can you do the next slide, please? And then I wanted to talk a bit more about some of the complexities in social work about involving people with lived experience in complex, real complex meetings. And I was thinking about safeguarding and best interest decision meetings when there can be a lot of people around the table. It can be a very serious meeting with a lot of emotion involved. And I think it takes a lot of planning to really help people to be meaningfully involved in those meetings and be prepared for them. So these are some of the tips, some of the kind of things that I've learned about in my experience as a social worker. One of the things to me that was really important is meeting before a formal meeting and really giving people time to talk through what the meeting might entail, what the meeting's about, maybe sharing information from the Mental Capacity Act or maybe from the safeguarding procedures to explain the purpose of the meeting. And then maybe thinking about different options for taking part in the meeting. Some people who I used to work with were quite worried about the formality of the meeting and they wanted to write down what their views were so that we could read them out in the meeting. Or they might want to just come to the beginning of the meeting and then leave the rest of the meeting. Other people wanted to be fully involved for the whole of the meeting. Can you move on, please? And then also thinking about during the meeting, how to really help people to be involved in the meeting. And I think some of the tips here were about making sure that people have the choice to sit down in the meeting so they could choose their seat before anyone else came in and think about, do they want to be near the chair? Do they want to be near the door in case they want to leave the meeting? And then thinking about, as a chair, what I could do really to try and help people to be fully involved. So sometimes it was appropriate to have ground rules when we know things might be quite difficult. And I would always say not to use acronyms so that people could really fully understand what was being said. And I think also thinking about what's not said in a meeting. So if people aren't saying anything or they're looking agitated, or sometimes at those meetings when people would start to cry, I think recognising that that's also expressing something and I would need to respond to that and perhaps stop the meeting. And then also thinking about planning a safe and private place. So if the meeting was getting quite difficult and quite emotional, we could stop the meeting, people could take a break, we might reconvene it, or we might just move it for another time. And then the other thing that I was thinking about when I was reflecting on this session was also about thinking about after a meeting's taken place, what can we learn from the meeting? So I would try and speak to service users and their carers and just ask, how did it go? Is there anything we could have done differently? And then also thinking about speaking to the minute taker and the social worker, the three of us together, about what have we learnt, what could we do differently, could we approach the meeting differently next time? So those are just a few tips from my experience. Do you mind moving on? Then the next part of co-production that I wanted to talk about was about involving experts by experience in recruitment and training. And this recommendation is also from the NICE guideline. And when I was preparing for this session, I asked some of the BASWA members from my local branch if they'd got examples that they could share with me of co-production. I'm just going to give some feedback about one of the responses that I received. So this is a social worker who was undertaking a retender of 2 mental health contracts. And she felt it was really important that service users and carers were involved in the development of the contract. So they were involved in the shortlisting process and in the interviews. And she said it was very helpful to have different views about what they felt were important. Some of the things that they felt were helpful were the things that the commissioner hadn't thought about. And she said that process is really helpful. Some of the things that were a bit difficult were that it was a big time commitment, so it did take longer to involve people meaningfully. And also they had to think as a group to work at the pace of the people that were involved. But overall, it was generally very beneficial. Do you mind moving to the next one? I thought it would be also helpful just to talk about who our new regulator, Social Work England. Myself and BASWA, we've been very involved in the consultations, and I know that Social Work England have been very keen on working with people with lived experience. And I thought it was very interesting in their draft standards for education and training that they make it very clear that people with lived experience of social work should be involved in the admissions process, and also should be absolutely essential to the design and delivery of social work training. So this is another example from my own practice as a social worker. So at one time I was a renal social worker, and part of my work was working alongside renal nurses and also people who were who had been diagnosed with kidney disease and had dialysis. And we used to talk to newly diagnosed patients about what it might mean to have dialysis and what support they might need. And the patients were really key in explaining what that experience was like and what support was available. Do the next one. So yeah, the next part of co-production that I wanted to talk about was about producing information, policies and procedures. And again, this is another recommendation from the NICE guideline. And I've got a link there to a blog that explains the importance of listening to people with learning disabilities, and when that happened, that it made a big difference in terms of commissioning and reduced hospital admissions. That was in Lincolnshire. Next slide, please. So this slide is an image from the NICE Quick Guide, Getting Help to Overcome Abuse. And this quick guide was developed by groups of young people who had experienced abuse and neglect. So it comes from the NICE guideline about children's abuse and neglect. And the children who developed this quick guide felt it was really important that there weren't images of young people on the quick guide, because they were saying as a young person, they might feel stigmatized picking up information that had images of them and might feel self-conscious. So they really influenced the design of this quick guide. And there is a blog that explains how they influence the guideline that you can have a look at. Next one, please. So the last section that I really wanted to talk about was about co-producing with people who have learning disabilities. And as Gavin said earlier, BASWA have recently published the capabilities for social work who have adults who have learning disabilities. And they have really been working closely with people with learning disabilities to produce that. And there's been 2 NICE guidelines that have been recently published. And again, they were also co-produced with adults with learning disabilities. So these are some quotes from some of the people with learning disabilities who are involved with the NICE guidelines. from a blog that they produced. And I think they're quite powerful quotes, especially like the one on the right-hand side. I want to be involved to make sure we aren't pushed under the carpet. And we know about how hard it is and can say things that affect our daily lives. So that photograph is 2 of the guideline committee members, and they were enjoying some time in London after having quite a long meeting with the guideline committee. And then these are some reflections from co-production from the NICE guideline, because this is the first time that NICE had involved people with learning disabilities in the development of the guideline. So comments about what went well in the first meeting was that there was a picture version of bingo to get to know each other. And I think that helped people to get up and go and speak to someone else. Presentations were in easy read. There were regular breaks. Support workers created posters and flip charts that were descriptive and engaging, and that's an example of one on the right-hand side. And I like it for how visual it is and how easily it explains some of those key concepts. And then I really liked the point about the food was great. And I think if we can make co-production enjoyable as possible, that really helps everybody. Okay, next one. And then these were things that didn't go so well in the first meeting. The hearing loop wasn't working. Paperwork was only sent a few days before the meeting, which made it hard to read it all. One document was an easy read and the other one wasn't, which caused confusion, and it got hot in the room. So I suppose those points just really emphasise how important it is that there's good planning and that a lot of time is thought about how to properly co-produce and how to really involve people and how their needs can be considered and what time is needed for that. Okay, next one. So there is actually a YouTube video about the different experiences of the people that were involved in developing the NICE guidelines who had learning disabilities. We weren't able to play it today, but I've just left the link there for your own information because I thought you might find it useful to look at later.
And what we can do with that, Charlotte, is distribute this to everybody so they can take a look at it later.
Okay, great. And then I just wanted to conclude really with the 6 principles of co-production which come from Think Local, Act Personal, recognising people as assets, building on people's capabilities, developing two-way reciprocal relationships, encouraging peer support, blurring the boundaries between delivering and receiving services, and facilitating rather than delivering. And I think quite significantly, making sure that power is balanced between people getting support and the people who support them. Thank you.
Thank you, Charlotte. That's really helpful. And as I said, we'll be disseminating these slides to everybody who's attended this session afterwards, and you'll be able to access it via the recorded session as well. Next, just before I pass over to Graham, who's going to be talking about the Charter for Disabled Adults and Social Workers, just another sort of reminder to everybody, please do send in your questions and comments. You can type them through and between now and the end of the session, and it'll be an opportunity for you to communicate directly with the panel. So Graham, if I can introduce you now.
Okay, good afternoon, sorry, and thank you for joining us. I'm really pleased to be able to bring a good news story about co-production. And I also would like to say thanks, Charlotte, for a fantastic overview of co-production. I really enjoyed listening to that and how much it tones in with our own experiences. I am a service user carer, and I've had, I'm an old man now and I've had a lot of experience of it. But and I work with BASWA as a service user carer, but also I'm vice chair of Shaping Our Lives, who were responsible with BASWA for the co-production of the working with social workers working with disabled adults. The Charter really sets out how to do that, how social workers can work with disabled adults. It is supported by a position statement, which gives reasons why it is. It gives reasons why it is important that we do work well together, and sets out how to do it. The Charter was thought about in late 2016 and was launched in February 2018. So it's a relatively new awareness document, and therefore most probably is why it's not fully on board yet. Although we're striving quite a lot to ensure that it is on board. We've had 2 Compass meetings, one in Birmingham, one in Manchester. We've also delivered it at in Bristol in 2018, September, and in Belfast late last month, 21st of June. The charter was conceived by Jerry from Basra, who then was the chair of the Adults Policy, Practice and Education Group, and Becky Meeking of Shaping Our Lives. Shaping Our Lives is a national service user group of disabled people, and Basra needs no further introduction. They met and decided it was very important that we had a co-produced document that could be used by social workers when dealing with adults with disabilities. And I do emphasise at the moment it is for adults with disabilities, although the standards and criteria could be equally shared, and we're hoping at some point there will be across other groups. So these Shaping Our Lives, as I've indicated, had a group of disabled adults, met with a group of social workers from Basra, and they met as equals, and that's very important. They respected, understood their points of view, welcomed them without any judgmental issues, and put together, produced the position statement and the charter, which set out where we go in terms of ensuring the well-being of disabled people. It's fairly interesting. In the forums, the debates that went ahead in producing this charter, there were several sort of quotes, and one of them was, we need to, we don't work as well together as we can, and therefore we must try and do so. And others were from the social workers saying, I only wish my organisation worked to the standards that are embodied in this document. And the one I liked most was that we must think big and act with ambition for each other. And I think that's a great starting point for us to talk about how this charter developed. The aim of the charter is not just to be another document that we think about or put on a shelf together desks. It is an action document. It's a benchmark, really, a template for us to start thinking, how do we really achieve change that makes a difference to the well-being and lives of disabled adults? We might ask, well, why was it necessary? Well, there was the necessity, I'll get that out, won't I? There was felt to be a need for clarity, for transparency in how decisions were made that affected people. And so and there was also a need for us to think in terms of how we went about that, the guidelines that were necessary. We'll come back to those in a moment. And then how was it produced? Well, it was co-produced, as I've said, adults and disabled adults and social workers working together as equal partners in true partnership. And it therefore related to social justice. And then we get to what is the charter? And it really separates into 6 elements. The first being guidelines. So again, we were saying, well, what's good? Where's the clarity here? How do we measure good? How are we going to set about determining what it is we do? The social charter was very important. The social okay, I'm lost for words. It's age coming in. Can somebody help me here? I'm looking at the social model. I've got it myself. The social model for we use, where it's a strength-based one. We didn't want the medical model. It works on the principle of human rights, really. and the fact that everybody should have equal citizenship in the community in which they live, the same opportunities. It was really based upon the Care Act and the Equality Act, which really embodies the same requirements. So those were the guidelines, well-being and independence being key. So beyond that, then we had the personalisation. What did the person who we were serving want? We must listen to them with proper intent and valuing what their needs were, what their aspirations were. Then the process. What process was being used? We had to be sure it wasn't mechanistic. It was really related to being human in scale, valuing the person who we are seeking to serve. Then relationships and rights. I mean, we had to be careful that we took on board people's wishes and cares and concerns, and we related to cultural differences. We were very, keen to ensure they were properly given proper space. Welfare and rights. Well, we had to be sure that we didn't just look in terms of what was available in terms of the models we often use. We had to consider a much wider sense of well-being, and certainly we had to ensure that any benefits that people were properly entitled to were properly sought and achieved. And then we had the wider context. And the wider context is the whole sense of well-being. It isn't just about health. It may not even just to be about a social worker determining how their first needs were met. It is a much wider issue about the environment in which people live. What's the housing like? What are the barriers that people face in terms of work and education? These are the things that we were anxious to ensure were embodied in that charter. I think I've said enough, really, and I'm quite happy to give way there and let Mark take over. But thank you very much for listening to me.
Thank you, Graham. That's really good. Can I just say before I pass over to Mark, this is, I think, one of a first, really. We have no questions put to us yet as a panel. Please do type up your questions. We want to hear about any comments. Maybe you've got some great examples. Maybe you've got some concerns that you want to share. Maybe you've got some dilemmas that you want to put to the panel. This is an opportunity, so please type up a question and send as soon as you can. So yeah, I'm going to pass over to Mark now. He's going to talk about some more about some thoughts around co-production. Mark?
Right, my role today, I think, is to talk about more about the practical side of working with service children, and also where I've been a professional working with disabled people as well, their professional, and how I co-produce with them. The first thing I think that I want to say is that it's important that when you co-produce, that you co-produce in the same way with everyone. That doesn't mean to say that you work with everyone in the same way, but you give them the same information and the same entry into your work, really. My example of this is actually when I joined FADRA, all I got was an email saying, please come to this meeting, where my colleague Graham and Methmar had a slightly different way into FADRA. Nothing bad about that, but I think it's important that when you are inviting people, that you invite them in the same sort of way. And if you're unable to do that, that the rest of the group know the different ways in which people have been brought to the group. So therefore, transparency is very important in that. So just to be clear on that. I think also what is very important when setting up co-production is to know what's happened before. If there's been any history of co-production in the organisation before you've been given a role, or what the people you might be inviting, to find out a bit about whether they've had any relationship with your organisation before, because that will then help you to have a framework of how your co-production is going to work, and what you are working with, and what you need to improve on, and what you don't have any ideas about, which you might want to talk to the group about. But my main message to you today is really to just know what you're about as practitioners, know what the wider society is talking about, and apply that to your work. So if you are working with individuals, one area of co-production I think is very underused is the social workers' use of the review process, because the review process is actually where co-production can happen when you're working with individuals and their families. And I do mean and not because service users and families are separate within that process. So you mustn't, wherever you can, you must make sure that when working with families, you are working with them both together and separately at the same time. But I think the review is important, because at the review process of their package, then that's when the co-production can work, because there is hopefully there is no crisis at that point, and service users can feel safe enough to go, well, this isn't working and this isn't working, and stuff like that. So please, if you're an individual social worker on the front line, or a social worker looking at research, use your review processes and make sure they're actually live processes and not just tick the box processes, because that's when the service user will probably feel more able to tell you a bit about when they feel they're able to talk to you about what's happening with them, without a fear of, oh, I need this service, so if I say this, they'll take this service away. I think the review process for individual service users should be turned into much more of a co-production process. So just have a think about that, and see how you can apply that within your working framework. Just to some more examples. When I was a capacity building officer for disabled people groups in the West Midlands, there was one particular group that I worked with, and I just sent an invite out to loads of organisations in Herefordshire, and I got there and I said, okay, then can you tell me a bit about what groups are out there in Halifax. And they turned around to me and said, don't worry about that for now. What are you going to do about the lift in our local train station? It hasn't worked for years, so what are you going to do about it? So we had a meeting about that. I thought that was all settled after one meeting. 3 meetings later, that was still the only issue that they wanted to talk to me about. So, before I could do my work, what I was set out to do, what we had to do was set up an action plan to make sure that that issue for them was resolved. It was resolved after one more meeting with the council, and we had a separate group working on that. And then I could talk to them about why they wanted a more wider group and what support they wanted from me. So be aware that you may have your own agenda, but just be open for at least about the first couple of meetings that people will see you working with them as an opportunity to have their say on things that should be related to your work, but might not be, but don't be afraid to pull people back. I was quite fortunate that that example was actually within my work, although it wasn't what I was there to do, it was within my broader work, so I was able to go with it. But people will come with their own issues that need resolving, so have an idea or have a chat to them about how they wish to deal with other issues that may be slightly outside of the remit. I think the other thing that I would say about co-production is that the actual meeting bit is the easy bit. The bit that takes your time is the emails, the phone calls, the reassurance emails and phone calls of people who are involved in your meeting, particularly if you have you're asking them to do a particular role or go to a particular place. That place may be an everyday thing for you, and you may have a lot. You may be travelling a lot. Some of these people may not be doing something, so be aware that people will have quite a lot of anxiety about quite simple things for you, but there's quite a lot of anxiety, and you have to spend quite a lot of time doing the past, what I call the pastoral role of co-production and service user involvement, whatever level your organisation is at, because there are different levels of participation that people can be involved in. So just be aware that for a lot of people what you're asking them to do is probably maybe the biggest thing they've ever done in their life. They're willing to do it very often, but you have to give them quite a lot of support to do that. The last thing I would say to you is to give you an example of how my 18 years of working with a university and now moved on. I've been working with a university for quite a while on admissions and on bits of teaching, but last year I was one of 4 people who got given the job, and it is a job, to co-facilitate a module. Now that means agreeing teaching, agreeing who's gonna teach. For example, I booked a part of that work. One of my jobs was to book a host today, Gavin, to come and talk to new students about what Badger was like and what they offered new students. So that part of my role was to book the part of my role was also to book other EVEs. So I was actually an EVE that was working with other EVEs on the same thing, but I had a different responsibility to them. So I would book EVEs to do personal talks about their social work journey or their social journey. I also booked other members of staff at the university to come and do how to log into the library and things like that. So to be involved in that was quite a challenge, and it's just been confirmed that I'm going to be doing a similar role this year as well, along with some of the people. So that's how far co-production can go if you get it right. And remember I talked about me being involved with this organisation for 18 years. So if at first you don't succeed, keep on going.
Thank you. Thank you, Mark. That's brilliant. Right, we do have some questions. And I've got Nazia, who apparently has got some dogs in the background, so we might hear some dogs barking in a moment. But Nazia, can I just ask, Nazia, are you able to tell us whereabouts in the country you're based?
I'm in England. I'm in Quarrybank.
Okay, Quarrybank. Nazia, can't hear any dogs, which is great. But I've got the. If you've got a question that you want to put to the panel.
Well, I've just done my first year at university. I've just finished my first year, and this is my first webinar that I've attended. And I must say, thank you so much. It is so insightful to what we actually learn in class, to hearing people talk about it, that it's actually being put into practice. Because it's okay sitting there learning this stuff, but like hearing you lot saying how important it is sort of gives me a good feeling for when we go into practice, when we do our placements next year. So thank you for that. And everything you've talked about, it's like the holistic approach and treating everybody individually, and just because two people have the same disability doesn't mean they can achieve the same things. And it's just so brilliant to like hear people actually talk and think, you know, thank you, it was really good.
Excellent.
So, no question.
Thank you, Nazia. That's very helpful. Okay, I'm going now to someone called Leonard who has a question. Leonard, can you hear us?
I'm not sure. Can you hear me?
Just about. It's a little bit noisy, but I think we can just make you out. Have you got a question for the panel?
Yes. Fascinating discussion. My concern is if we still haven't grasped the principles of the Mental Capacity Act, the 5 principles, how are we ever going to treat people as equals?
Does anybody want to take that question?
I think it's about making sure that and some of this is what I think Badger is and other and noise incidentally, and therefore so we do seem to have the laws in place quite a lot, but the application of the law does seem to be what's it. So all I would say is that I keep lobbying people for the last 24 years, and yes, we've got this, but how does it work? for example, one of my questions today was, well, what did the audience get out of it? So from my point of view, I'm always asking, well, what happened next to every organisation I work for. So it's a very important point that you made, and I suppose that people have to realise that there's a whole lot more that comes with it than just passing laws and saying that this should be done. And I think that Badger and other organisations at all levels need to make sure that they are progressing this work. But I suppose the other issue is that whenever you're dealing with policies, you've always got new people coming in and interpreting those policies differently. So the case always has to be made. So I would support you in making your case about the principles of the act that you talked about.
Leonard, can I just say, I think that's a very interesting question in the sense of equals. In truth, of course, we can't treat everyone as being the same, and one size doesn't fit all. And so when we use the word equals, we really mean that we give everyone the same opportunity. So it's an equality of treatment rather than people being equal, because let's face it, we're not all equal. We all have different levels of capability or capacity. And so, but in truth, what we have to do is ensure no one is disadvantaged by whatever system operates. We have to try and ensure everyone has the same level of opportunity to gain an equality of life that is suitable for them. I don't know an easier way to respond to that, really.
Perhaps there's some alignment with both principles, with the Mental Capacity Act and co-production. The starting point for both is thinking about how to involve people in all decisions and how to support people. Perhaps some of the complexities of co-production, some of the things about thinking about how to involve people with lived experience in commissioning and delivering services, that's perhaps a newer concept and something that we all need to think about a bit more. But I think the first part about how you involve people and support them to take part in decisions, that's at the core of social work, and hopefully that's something that is the starting point of all of our work.
Yes.
Thank you, Charlotte. Leonard, I hope that was helpful. And remember, this is for everybody to remember that as BASWA, the professional association, it's a great way to sort of have a platform to get messages out. And the key to any good policy is to have, good campaigning and just constantly revisiting the message. And I think, as Mark was saying, keep trying and keep pushing when we have to. And that's with our various policy groups. That's what we try to do. I'm aware of time not being on a side now, so I'm going to move on to Camilla. Camilla, can you hear us?
I can hear you. Can you hear me?
Absolutely, yeah. Do you want to put your question forward?
Yes, my question is about independent advocacy, as independent advocacy can be very important to co-production in certain circumstances, when people can't speak on behalf of themselves in a certain meeting, for example. But what are your views on independent advocacy being funded by the local authorities, and whether this has an impact on conflict of interest? So I've been working with a family recently who believe that because the local authority are funding the independent advocacy, that the providers of the independent advocacy don't feel free to challenge the local authority because they might lose their contract. So I just wondered if you had any thoughts on conflict of interest to do with funding of independent advocacy.
Interesting question. Can I
respond to that a bit? Yeah.
Okay. That's a very interesting question indeed, because I mean, I've used independent advocacy actually when I took up an issue with the National Health Service, and they were funded by the Health Service as part of the advocacy service. But I found no conflict whatsoever. Well, I don't know if there was a conflict, but I certainly found I had a high level of support. It's rather interesting because I am a confident, assertive person, but I only used the advocacy service so they had a record of what was going on in terms of my engagement with the NHS, with the complaint I had. I didn't really feel the need to use the advocate to speak for me, but I wanted the advocacy to be there, the advocate to be there to ensure that what was said was recorded and, if you like, as a third party. And that worked extremely well for me. I got extremely good advice. So my experience, and indeed support, and in fact they even agreed that they even got the NHS to pay my travel costs to get to the meeting with them, which was okay. But it is an interesting, my experience was that it worked very well for me. And as such, I thought it most probably worked well for other people. But in a sense, that's what we're doing, isn't it? We're seeing how it affects us, and we're using that then to forward our views about how it works for others. So, as I don't have any experience of it not working, I don't know. I am in situations where we have advocates speaking for people, particularly people. I mean, as I've indicated, I am the vice chair of Shaping Our Lives, and we have 2 people with learning disabilities on the board, and we have somebody supporting them, and he is fantastic as an advocate for them, in that he never speaks for them. He always asks them, do they understand what's been said, and then asking them if they would like to respond to the question or the issue that is being debated. And rarely does he speak for them. Occasionally they'll say, we want you to speak for us. But on the whole, he makes sure that they speak for themselves. So in that sense, I find that works extremely well. But thank you very much for your question.
Okay.
I think my issue with independent advocacy were 2. Whether that independent advocate had another role within the local authority, which I very often find is the case, and B is whether that how much preparation time had the independent advocate and their client had to work before they actually go into the advocacy setting or the case setting. Because I think those are 2 issues. As for the funding, at least it's been funded, I would say these days, where a lot of people do not even get access to an advocate source because of funding or because of what type of disability they've got, there's limitations on that. So if they are willing to fund it, then that's a good thing. But the 2 issues I've spoken about before are really my big concerns about advocacy.
Thanks, Mark. It's one of those difficult ones because on one hand you want the advocacy out there, but on the other hand, it's the questions about conflicts of interest can always be there. But the key thing here is about quality standards and good outcomes for people. Okay, Camilla, I hope that helps answer the question. Of course, on a more general point, if anyone ever becomes concerned about these sorts of things, again, as I mentioned before, we have these are the kind of things that you can work with BASWA on. We'd like to hear about any sort of more generally any areas of practice that you think we can improve on, and we're always looking to work to improve standards in social work. I've got one final question now from, I hope I'm pronouncing the name right, Ursum. Ursum, can you hear us? No. In that case, I think it's a question for me to read out. Ursum?
There we are.
Okay, Ursum, I can't hear you, so I'm going to read out your question. It's quite a lengthy question, everyone, so just bear with me. So, so we're getting some positive feedback generally about webinars. Ursum, I think I'm seeing a very lengthy question here, Ursum, but it looks it relates, I think, to research and everyone can bear with me.
We are.
I think what we have here is a request for us to feed it potentially into some research. So rather than me ask that as a question now, that's something that will come back to you directly on Ursum. I think there is just one additional question that I'm going to put to the panel now, everyone, and it's one that was put by a colleague, and it says here: all social workers support co-production. However, the reality of fitting this into a busy work schedule is difficult. Do you have any suggestions?
I think, if you don't mind me starting,
Yeah.
I think that is a true question, that it definitely can take time and it can be difficult. But I think it's thinking about the value of co-production. And I think, as we've talked about, it's important to think about the individual's needs and putting time into how really people can be meaningfully involved. But I think the benefits of people being involved is that the service is better and people get a better experience and the outcomes are improved. So I think putting that planning time in and putting that time in to talk to people about what support they need so that they can take part in it gives greater ownership and really leads to positive outcomes. So I do agree with it, but I think it is beneficial.
Yeah.
Okay. I'd like to say, I think the most important thing here is that an effort is made. And the fact that it doesn't have a perfect outcome is one of those things we have to take on board. The truth is, it is very time consuming to be fully involved in co-production. And maybe not everything you do is going to be co-produced, even though you wish that would be or could be the case. But the important thing is that we make an effort to do at least something or go some way towards it, towards perfection, I mean. And where you can, I mean, I think the social charter, for instance, for social workers working with disabled adults, is a very good example of how well it worked from the start to the finish. The idea was born, they met, they discussed, they agreed, a charter was born. And now we're trying to put that into action. And I think that's a fantastic thing. But it did take a long time and a lot of effort, and that can't possibly happen well, it may, but on the whole, it can't happen in most situations because life runs at too quick a pace. But the important thing is that we do value people. We know we need to speak to them. We know we need to engage properly. And we know that we have to take on board what their needs are and try and meet them. And the only way to do that is to do it with them rather than to them. And you know, that's one of the old adages that is used. And it is important that we try and do that. But I think the most important thing is that we're honest with each other. And we say we're trying to do the best we can. And I've got a classic example. When I worked with Healthwatch, I was a trustee of Healthwatch in Sandwell for 2 years. Very little real effort was made to meet my access needs. And I kept complaining and still they didn't really do it. I now work with the CCG. I'm a patient representative on the clinical commissioning group, the patient partnership advisory group, and they make every effort to meet my information access needs. And I'm so delighted to be working with them because they make that effort. And so they're clearly valuing my contribution as I value the efforts they're making to meet my need. And I think that's the important thing, where we are honest with one another. We know we can't be perfect, but we're trying to be.
Co-production is difficult. Well, people are difficult, but we have to deal with them. So why not do it together?
Absolutely.
Yeah.
Thank you so much, everyone. That's a really good place to end, I think. Listen, everybody, thank you so much for joining this webinar, whether it's the recorded version or the live version. We do have, on the 4th of July, another webinar coming up on working with older people who are lesbian, gay, bisexual, trans and plus. It's going to be another really good session, and I think it fits quite well with this running theme of co-production for this week. So thank you very much, and thank you to the panel.